It's another day with the physicians where your health is our business. It's growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what do you know?
You're welcome back to the training also of your regular program.
As you rightly said, positive aging is now a global approach. And we don't need to wait until people are aged.
Sickle cell disease is a group of blood disorders typically inherited from a person's parents. The most common type is known as sickle cell anemia. It results in an abnormality in the oxygen-carrying protein, hemoglobin, found in red blood cells. This leads to a rigid sickle-like shape under certain circumstances. Problems in sickle cell disease typically begin around 5 to 6 months of age. A number of health problems may develop, such as attacks of pain, also known as sickle cell crisis. You have anemia, swelling of the hands and feet, bacterial infections, and stroke. Today on your regular TV health talk show, The Physicians, we shall be discussing sickle cell disease and pain management. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, anchor on this program. And of course, I'm not alone. I have my very elegant, beautiful, all in all co-hosts.
My name is Dr. Yusuf Kadri. Of course, you know, on this program, your health is our business.
Always our business. We're going to be discussing sickle cell disease and pain management. Each time we want to talk about this topic, it sort of brings back some memories, for families, friends that are actually dealing with patients, siblings, children, colleagues, you know.
It's that pain that comes with it. Yes, it's not like it's everybody that has a pain all the time, and of course in different, magnitude, but that pain is what you can't describe. You have never seen, even the doctors.
Yes.
When they tell you that they have crisis, just be there for them. In the 90s, early 2000s, it wasn't now. So both she and her husband are ASAS. And for that,
they didn't do any genetic counseling?
So for that, any one chance, at 1 out of 4. They were having that one.
Oh my goodness.
And so it was even the third one out of the 5 that is AA.
Wow.
The third one. So the third one was not like a minimum. It's not like she was even elder. She was just 9 as of the time we met her, because she was part of like a clinical presentation. The woman was practically living in the hospital.
I can imagine. I can imagine.
One child.
Yes.
They are bringing a second one. Maybe they will discharge the first one. They bring, like...
You know, when for these patients, there's a whole lot that they go through. Apart from the family, friends, it drains. It's financially demanding.
Emotionally, spiritually,
everything. But you have to give your all. Yeah. You have to give your all to that child.
When they are doing counseling, she's like, I'm tired. I just want to walk away.
And sometimes the children will say, I think I need to just go.
That's it. In fact, the children.
And so you can imagine that heartbreak. Let me go, and you know, it's a whole. It's good. It's very, very important.
People don't rush it. Now we are more technologically savvy. More researches have come on. People shouldn't just.
So well, for today, I'm very excited because today we've talked so much about sickle cell disease, anemia, and we'll just give a little pinch at what is sickle cell. Yeah. Then the guests will deep dive into how to manage pain crisis. So that the people at home will be able to understand, okay, when somebody has the home management, the care, and support. Well, today we'll be talking about sickle cell disease and pain management. When we come back, you will get to meet our very beautiful guests who will be handling this. Stay tuned. Welcome to the Physicians, where your health is our business. Today we'll be discussing sickle cell disease and pain management. I think we'll have a surprise for everyone watching this moment. As our guests, I decided to keep this to this very moment before revealing something to you all. She is actually a warrior. She is a survivor, and she's doing great. Help me and welcome to our studio, our guest, Maureen Nwachi. She's actually a trained genetic counselor, a certified emotional intelligence and anger management practitioner. She serves at the Sickle Cell Advocacy and Management Initiative. Maureen Nwachi, welcome to our program.
Thank you very much.
Welcome, Maureen.
You look good. Your glasses like.
Thank you very much.
You really look fabulous with those glasses.
Thank you.
Trust me.
You. I really appreciate that. Thank you.
So welcome to the Physicians. How are you doing?
I'm good.
Good. Really good.
Thanks
Love
for having
the
me.
smiles. Thank you. Okay, so we're going to be talking about sickle cell disease and pain management.
Okay.
Let's first of all start with, as a warrior, let's start with what do you think sickle cell is?
So sickle cell is a genetic blood disorder. I inherited from both of my parents, my father and my mother. So in the medical language, they'll call me HPSS. So, but to the layman out there, they'll say she's SS or she be sickler.
Exactly.
But that is a word people in the sickle cell community do not like to hear. So yes, it seems derogatory, yes. So we prefer to call ourselves warriors.
While we're doing our own conversation, our chit-chat would just like, we had to put ourselves in the position, how the feeling, when you talk about the bone crisis, how the parents manage. So you are here live. You want to just tell us the experiences. How did you feel from childhood up until this particular time?
Almost 38
years.
Yes. So, well, it wasn't easy at some point, but now I would say it's easier with knowledge, with lifestyle modification, with great support system. It's quite easy. But growing up, I used to have a lot of pain crisis as a child, or even in my teenage years. I know I can still picture my father crying one of those times in the hospital where I was crying, and he kept telling the doctor, give her something, give her something. And the doctor said, we already gave her something, so it has to take a while before they can administer another pain medication. So it used to be tough. We lived in a small town where we grew up, my siblings and I, with my parents, and we used to travel all the way to Edo State, UBTH, University of Michigan, just to have our
The treatment.
yes, checkup, yes. Our routine checkups, yes, all the way from Kogi State to Edo State.
Wow.
Seriously?
Yes, so
And how often did you do those checkups?
it depends on the appointments, but my parents made sure we never missed. And when I say we, I used to have 2 other siblings living with sickle cell.
Wait, how many
Although
are you children?
one late now
Okay.
due to a sickle cell
Right.
complication, kidney issues. Yeah, he died at 43. He lived up to that. Has a family.
Sorry.
Wow.
Yes. So my elder sister is 45, living with sickle cell. So I'm here.
How many are you?
We used to be 6. Now we are 5.
So it's of the 5, so at least there's one that doesn't
there are
have
3 more without sickle
sickle
cell.
cell.
Yes.
Okay, so go on.
So we used to go all that way just to have our routine checkups, and my parents made sure we never missed them. I remember one time between 7 and 8, when I was about 7 or 8, I had this complication called osteomyelitis.
Okay,
and
the bone.
yeah, so I had to keep going back like every 2 weeks because I refused to be in the hospital. Yes, I was asked to, my parents were asked to keep me in the hospital for an extended period for them to administer a certain medication and ensure there was an antibiotic that needed close monitoring. So I know I kept crying that, no, I don't want to stay, I don't want to stay. And my dad said, okay, she can't stay, is there an option? And he said she has to keep coming as often as, so every 2 weeks. I think we did that for 6 months.
From Kogi
Yes.
to UBTH. Your
So
father
every,
is strong.
every month, twice a month, in
Yes.
6 months, like 12 times.
And you didn't
Bless
mind,
your
your daddy is
daddy.
actually, that care.
Yeah. So,
Ah.
well, that's it. When you have great support system like your family, parents, siblings, I think it makes it easier. It makes it easier. If not, the organization such as ours would not be here doing what we do because a lot of people do not have it this easy. A lot of people are stigmatized by their own family, by their own parents.
Okay, how about in school? How did you manage in school?
Exactly.
Well,
Primary, secondary, university.
How were your mates relating with you? The teachers, how were they relating with you?
everything was fine. I mean, even when I had to change, when I moved from primary to secondary school, I know my parents went to school, spoke with them and told them, this is, I live with sickle cell, you have to minimize whatever punishment you are giving, you have to, I used to be a bit sporty. I grew up with my brothers more.
Okay.
There were just 2 girls, she's much older. So I loved participating in sports. Well, my mom always made sure that, no, don't allow her to participate in any inter-house sports, so please don't allow her. It used to be, I used to feel bad about it, but that was it.
Sure,
Yes.
Feel that could be a trigger.
Yes.
And that's why it's good for us not to know. Let our viewers know the signs and symptoms and triggers.
Okay, so for new parents of children with sickle cell, they may not know on time until they run some tests, which is why we always tell people to, we ask you to get your genotype checked before you start having children or before you get married. So one of the earliest symptoms is for babies when they have this hand and foot syndrome called dactylitis, swollen hands and foot, and they keep crying a lot. They have fever. You keep going in and out of the hospital, or sometimes they even give, administer medication in the home, not knowing what's going on until they get to the hospital and the doctors are like, you have to check the child's genotype. So that's one of the earliest symptoms. I was told I used to cry a lot as a baby and they didn't ever know what was wrong until I was diagnosed at 9 months. So that's it. Then for the bone pain crisis, you have children who complain, my knee today, my ankle tomorrow, my elbows and all that, and you keep wondering what's wrong. So these are symptoms, these are little signs and symptoms. And the anemia, where you see the someone's eyes jaundiced, yellowing of the eyes, paleness of the skin, and then you are told the person needs to be transfused. There's no blood in the system. So these are just signs of sickle cell disorder. And
you get breathless at times?
Yes, you get breathless at times.
Okay.
Yes.
So what are the challenges that are faced by the sickle cell warriors when it comes to pain crisis? What are the challenges? Because you talked about the hand and foot and medications, and your daddy even said, please give her medication, and the doctor said, not yet time. What are the challenges that are usually faced by these warriors?
Well, when it comes to pain management, we have found that a lot of doctors, in this part of the world are yet to understand the intricacies surrounding sickle cell disease. So managing pain sometimes can be hard, especially when they think or when they know. Yes, I know some people, due to the pain they feel, they have learned to become dependent or addictive to certain pain medications. So sometimes it is hard to tell that somebody is actually in pain and they need the medication. So there's well, I'm not a doctor, but there's certain criteria. Like, I know when I'm in the hospital, there's when the I think pentazocine is given, and you have to wait for 8 hours before you administer and down. But in between that, there are other pain medications that are being given so that I don't, fall back into crisis. Yeah. And I think after the second day, I even start refusing. I know, don't give it to me again. I'm now okay. I can do it, diclofenac or paracetamol, till I leave the hospital. Okay. So that's it. So pain management, it's very crucial. Because another thing is getting to the roots of the issue. What is causing the pain? Could be an infection. It could even be stress. Psychological issues could trigger pain crisis for some people. So all these things are important, and that's why we also advocate for mental health to be a part of the whole program for sickle cell warriors as well.
Just hold it there. Even though they live with the same disease, there's no need to compare them, because one's own threshold is different from the other person's threshold. They are very unique in their own ways. When we come back, we'll talk more on sickle cell disease and the pain management. But then be prepared to tell me the role of family in managing sickle cell disease patients. Viewers out there, we need to keep a date with the physicians and hear what you have to say about sickle cell disease and pain management. Do you have somebody? Do you know someone who is surviving, who is a warrior? And have you been able to render support in one way or the other to a patient who is actually dealing with sickle cell? Do you advocate that people that have AA, AS, SS should get married? When we come back, we'll hear more. Stay tuned.
Yes, I know my genotype. I'm AA.
Yes, I know my genotype, sir. I'm AX.
It's AA.
Sickle cell disease is mostly from when two different people when two different people are AS and they get married and they endanger the children having SS.
Sickle cell, from my biology class I learned, is a disease that is caused as a result of the cell, the white blood cell. Instead of them being spherical, they go as if they are semi-curved, not the spherical that the normal blood cells used to be. So as a result of that, they prevent the passage of blood, the free flow of blood.
In my secondary school, there was a particular girl, she was an SS patient, which one day, like, she was just complaining that her body's paining her, stuff like that. So we had to rush her to the care line. She was giving drips and injections and drugs.
Oh, not one, not two. The first experience I had about sickle cell patients is when I was in primary school. I used to have a neighbor that was a sickle cell. So he's sick today, tomorrow he's LD, next tomorrow he's down again, he's back again. The parents spent a lot. You see little time, they say he's having hand pain. Another time he's having a headache, he's down. So he's always up and down. In the long run, he passed away.
No, I only saw them passing through. Like, I don't have anyone as friend.
Welcome back. If you have just joined us, we're on to your regular program, The Physicians, where your health is our business. We've been discussing sickle cell disease and pain management with our warrior, no other person than Maureen Nwachi. He is actually a trained genetic counselor and a certified emotional intelligence and anger management practitioner. Okay, so I want you to just tell us more. What do you think is the role of the family in helping the warriors survive?
Okay, so the family plays a major role. I mean, I see a lot of people just have children. It's like marriage is a finish line, then having children is the trophy they get for it. And then you are not taking care of the child. So this has nothing to do with a child with chronic illness now. I mean, just generally, and it's crazy out there. So imagine now having a child or several children with a chronic illness such as sickle cell. So the family plays, it should play a crucial role. I mean, if the family, the immediate family, accepts that, okay, this is how my child turned out, and it is because of us now, the parents, it's because of us the child is like this. We learn, they learn what to do, how to take care of the child, how to nurture the child, support the child through the child's growing years. I think everybody living with a chronic illness will be confident today. A lot of people living with sickle cell, they are not confident in themselves. They are not, they feel they cannot amount to much. And if you trace, most of these things start from the family, where they tell you, where the family is already expecting that at a certain age, the child would die. And they start telling you things that would, make that child start thinking, okay, so at this age, I'm not going to amount to anything. I'm just going to be there. Some don't even try to train their children, take them to school, train them. I've seen a couple like that. There's no need sending him or her to school.
Wow.
Yes.
Die.
They have
Wow.
to, exactly.
Wow.
So
That's not really nice.
Practices.
Exactly.
Yeah.
So how do you now expect that person, even if they don't die early, they would never appreciate living. They will never amount to much, if in quotes, It will only take extra, for them to do extra to get to that point where they can say, okay, look at the story of Adekunle Gold. Perhaps those were the things that happened to him.
Adekunle Gold is what?
People didn't know that he was a sickle cell
Yeah.
warrior. Yes. Many people
Adekunle
didn't.
Gold?
Yes.
Like, seriously?
Yes.
Yeah.
So perhaps that was the reason he kept it to himself. And now that he has gotten to that level. He wants to tell people, okay, you think,
I'm a warrior, I'm a survivor.
and this is it, and this is how far I have come. Yes, it's very encouraging.
I think that is part of the new song.
Yes, yes.
So tell us about Sammy, because Sammy is doing a great work, with sickle cell advocacy and management initiative for survivors. Of course, we know there are other foundations, but people are also in the forerunner for this advocacy. So let's hear about Sammy.
Okay, so what we do at our organization is cater to people who live with sickle cell only and their families. So we have several projects that we use to help them. One of such is our free monthly clinic that has been running for over 7 years now. And we have over 700 beneficiaries. So we have like 200 on the average that attend this clinic every month. So it's free consultation, free medication, everything is free for that 1 month. So it's like a bridge between the underserved community, sickle cell community, and the hospital or healthcare providers. So that way, because we find that a lot of people, when they think about money, they can't afford routine medications. When they start having complications and they are not found on time, they are not diagnosed on time, it can lead to maybe early death or even become worse. So this is a way for us to mitigate against that. So that's why this clinic runs. We have a project called Warrior Rescue. That's where we give financial aid to people living with sickle cell who are either admitted in hospital or who need admission.
You have anyone right now?
Right now, we have several in Louth and Lagos Island General Hospital. And one very notable one is the pregnant warrior that was admitted at 32 weeks with acute chest syndrome, anemia. I mean, she was She was on oxygen for several days, and she was transfused with blood for, I think 5 pints, with 5 pints of blood. But now she's okay. Her baby is okay. Yeah, she's put to bed. Her baby is okay. And we actually spent quite a lot of money on that. Yeah. And she comes from a home, just like I was saying earlier, where no one wanted to know if she existed because she lives with sickle cell.
So the organization, is it collaborating with other hospitals?
Yes. Yes,
so to see the patients or visit them.
Yes.
And how do you get your funding?
That is what I was going to say. Hey,
how do you get your
funding?
Funding, it's since COVID, it's been very difficult, but we still try from individuals, a few organizations that will look our way. So many organizations, it's not if it's not a thing of interest to them, then it's so. But funding can be difficult. I must say it's difficult.
What do people need funding for? Talk to our viewers. Somebody is watching and listening.
And maybe want to assist.
And they want to assist.
So you are the physicians, really. Yes. So many people are watching.
So we need funding for our free medical outreach. Okay. It's monthly. It's been running for 7 years, and it's been saving lives. It's been saving lives. The free medical outreach is where we found this lady who just put to bed. Right. Someone introduced it to her. She came, and she was able to call us when she needed help.
Thank you very much, Maureen Nwachi, and we really, really appreciate your time on the physicians. You have actually schooled a lot of people. You have given hope to people that are also watching that it is possible, and the determination that you actually used. You're actually a warrior. Again, thank you so much for keeping a date with us on your regular program, The Physicians. My name is Dr. Martina Agbere. Stay blessed.
Please kindly follow us on all our various social media platforms, Twitter, Instagram, Facebook. And if you've missed any of our episodes, they are right there on our YouTube page. You can binge watching several episodes and be enlightened. If you want to be a part of the program, our website is up and running, The Physicians. A form there is there for you to fill, and you'll be right here with us in the studio. Till next time, remain blessed.